When should a person who has excess skin choose to get a surgery to remove that skin after they lost weight? I want to help you answer that question in this video by talking about the timing, the cost, the procedures, and some of the risks that you may want to consider when it comes to getting a surgery to remove excess skin after weight loss. Let's jump right in. So there are a couple of surgeries that people can undergo to help remove excess skin, or what some people would refer to as flabby skin from different parts of their body. If you've ever asked the question, can I lose weight in one part of my body if I'm doing it naturally? And the answer to that question is yes and no. The answer to that question is yes and no because it depends. You can't spot reduced fat in your body outside of doing a surgical procedure. However, when it comes to natural mechanisms like eating right and dieting and working out, you will be able to improve the contour and the shape of your body in those areas, but you won't be able to determine when your body chooses to lose fat from what particular area. Now, for people who want to get a surgery or already know that that's an option for them, let's talk about a few of those things. And I'm going to highlight 4 key areas where people typically will be getting a procedure done. The first one is called a tummy tuck. A tummy tuck is what we call an abdominoplasty, where they're actually going to remove some of the fat from the tummy area, and this is what it looks like. Part of what they do is they remove the excess fat and skin from the abdominal region, and what they're going to do is help tighten it up to help the abdominal muscle stay nice and tight. Some of the risks that are associated with the abdominoplasty include infections or bleeding, scarring, fluid accumulation, numbness or nerve damage to the area, and occasionally blood clots. So this procedure has risks that are similar to the other procedures that I'm going to mention, but one of the things that we want to also think about is the recovery time that it takes to get better. So typically this recovery process is going to start within the first 2 to 4 weeks, where an individual is going to be able to return to some light activities like walking, being able to lift things under a certain amount of pounds. Every surgery might be different, but just think about light activities, anything that's under 10 pounds or less for that first month at least, and a full recovery could be expected by 6 to 8 weeks, but there's a caveat with that. Full recovery means being able to get back to very basic daily activities in a normal capacity, around 80 to 90% of yourself. And getting back to higher level activities like working out and things like that can actually take longer. What's the total cost for a surgery like this? This can range and vary based on location and the amount of fat and other health conditions that are going to be factored into the surgical procedure, but anywhere from about $8,000 to $10,000 is what a person can expect. The second kind of surgery after a tummy tuck is a arm lift, which we call a brachioplasty. So that is the fat that hangs on the bottom of the arm, and the associated risks with this particular surgery are the same. We can think about infection, scarring, numbness, or even asymmetry to one side in terms of if surgery is performed on both sides, or just the fact that even though the surgery is performed on both sides, it may not look exactly symmetrical to the other side. Again, other risks that we might want to think about are the fluid buildup that we have, as well as the potential for some numbness to the area that was affected or operated on. And when we're thinking about some of the recovery process we're going to have to go through, the same idea applies. The first 2 to 4 weeks are going to be light activities that we might be resuming. By week 4 to 6, we may be getting back into some exercise approved type of activities. And within 3 to 6 months, we might begin to see more of the total visible result or final outcome of the procedure. The cost or the range for this may usually be around $6,000 to $10,000. It can vary. It really depends on different factors like location, environment, and the extent of the surgery, but that's a ballpark room estimate. The next type of procedure that's very common is the thigh lift or the thigh-plasty. It's where the fat around the thighs are actually being removed, as well as the excess skin. So let's talk about some of the associated risk factors with these procedures. One of them that's different from the others is the associated risk of poor wound healing because of friction at the thighs. And so this can reduce the level of healing that takes place, or the rate at which the healing takes place. But some of the other risk factors are common with the other surgeries, like numbness to the area that was operated on, decreased nerve regeneration, and infection or bleeding, as well as asymmetry to the surgical site that was operated on. The same concept is going to apply. We're thinking about 2 to 4 weeks of light activity, 6 to 8 weeks of resuming and regaining normal functional capacity, and 3 to 6 months being the timeline that you would expect to see yourself at a place physically where it was like the surgery hadn't happened and you're back to 100% your normal self. Total cost for the surgery is expected to be somewhere around $8,000 to $12,000. So let's talk about the last and final procedure, which is the total lipectomy, or the body lift, where we are actually addressing different areas at the same time. Potentially, we're talking about addressing the tummy, addressing the thighs, in different areas of the body in a multiplied fashion. This can actually range from around $15,000 to $30,000 depending on the extent of the surgery, but there's also going to be a longer healing time because there are other areas that are affected, and this can take a longer process of time, even involving a hospital stay for a certain period of time because of some of the areas that might be addressed, affecting your ability to walk for a period, your ability to lift or to move or to do basic things for yourself. There may be a hospital stay that's involved, going from the hospital to a rehab facility, and then being able to, within 3 to 6 weeks, start resuming normal light activity, and then from there going on from that 6 to 8 week mark, being able to resume more moderate activity, and within the 3 to 6 month range, there's a possibility of being able to be back to 100% normal, but possibly longer depending on any complications with the surgery, as well as decreased recovery time or increased recovery time that we have to endure. Again, some of the risks associated with this particular procedure include longer recovery time, blood clotting, weakness within the body overall and deconditioning, and as well as nerve issues in terms of sensation where the operations were done, having that go numb and having that to take a little bit of time to recover. So what are the solutions or the options for people who actually want to get rid of excess skin? One of the best things that we can do to avoid having to get surgery in the first place is choosing the best method for weight loss, which includes exercising to help your body actually adapt over time as you lose weight, so that you actually are seeing your body transform without having yourself go through this phase of loose skin, being unattractive or even unhealthy for our body for the reason of bacteria or germs or disease carrying agents affecting our skin and our tissue. So if you found the video helpful, like it and leave a comment. Let us know what you found most helpful about the video, and follow the page for more helpful content. You can subscribe because we make videos to help you stay healthy, pain-free, fit, and mobile, and to discover the wealth that starts with your health. I'll see you in the next video, and thanks for subscribing.